Gonorrhea is a sexually transmitted infection, also called a sexually transmitted disease caused by bacteria. Sexually transmitted diseases are infections spread mainly by contact with genitals or bodily fluids. Also called STDs, STIs, or venereal disease, sexually transmitted infections are caused by bacteria, viruses, or parasites. Gonorrhea bacteria can infect the urethra, rectum, female reproductive tract, mouth, throat, or eyes. Gonorrhea is most commonly spread during vaginal, oral, or anal sexual activity, but babies can get the infection during childbirth. In babies, gonorrhea most commonly affects the eyes. Avoiding sexual activity and not having sex prevents the spread of gonorrhea. Using a condom during sexual activity helps prevent the spread of gonorrhea. Being in a mutually monogamous relationship in which both partners have sex only with each other and neither partner is infected also limits the risk of an infection. The symptoms. In many people, gonorrhea infection causes no symptoms. If there are symptoms, they often affect the genital tract, but may also occur in other places. Gonorrhea affecting the genital tract. Male symptoms of gonorrhea infection include painful urination, pus-like discharge from the tip of the penis, and pain or swelling in one testicle. Female symptoms of gonorrhea infection include increased vaginal discharge, painful urination, vaginal bleeding between periods such as after vaginal intercourse, and abdominal or pelvic pain. Gonorrhea at other sites of the body. Gonorrhea also can affect these parts of the body. 1. Rectum. Symptoms include anal itching, pus-like discharge from the rectum, spots of bright red blood on tender tissue, and having to strain during bowel movements. 2. Eyes. Gonorrhea that affects the eye can also cause eye pain, sensitivity to light, and pus-like discharge from one or both eyes. 3. Throat. Symptoms of a throat infection might include a sore throat and swollen lymph nodes in the neck. And lastly, joints. If one or more joints become infected, the affected joints might be warm, red, swollen, and extremely painful, especially during movement. This condition is known as septic arthritis. When to see a doctor. Make an appointment with your healthcare professional if you notice symptoms such as burning sensation when you urinate or a pus-like discharge from your penis, vagina, or rectum. Also make an appointment if your partner has been diagnosed with gonorrhea. You might not have the symptoms, but if you have the infection, you can reinfect your partner even after your partner has been treated for gonorrhea. The causes. Gonorrhea is caused by the bacterium Neisseria gonorrhoeae. The gonorrhea bacteria are most often passed from one person to another during sexual contact, including oral, anal, or vaginal intercourse. The risk factors. Sexually active women younger than 25 and men who have sex with men are at increased risk of getting gonorrhea. Other factors that can increase your risk include having a new sex partner, having a sex partner who has other partners, having more than one sex partner, and having had gonorrhea or another sexually transmitted infection. The complications. Untreated gonorrhea can lead to major complications such as 1. Infertility in women. Gonorrhea can spread into the uterus and fallopian tubes, causing pelvic inflammatory disease, PID. PID can result in scarring of the tubes, greater risk of pregnancy complications and infertility. PID requires immediate treatment. 2. Infertility in men. Gonorrhea can cause inflammation in the epididymis, the coil tube above and behind the testicles that stores and transports sperm. This inflammation is known as epididymitis and without treatment can lead to infertility. 3. Infection that spreads to the joints and other areas of the body. The bacterium that causes gonorrhea can spread through the bloodstream and infect other parts of the body including joints. Fever, rash, skin sores, joint pain, swelling, and stiffness are possible results. 4. Increased risk of HIV and AIDS. Having gonorrhea makes you more susceptible to infection with human immunodeficiency virus, HIV. the virus that leads to AIDS. People who have both gonorrhea and HIV can pass both diseases more readily to their partners. And lastly, complications in babies. Babies who get gonorrhea during birth can develop blindness, sores on the scalp, and infections. The diagnosis. To determine whether you have gonorrhea, your healthcare professional will analyze a sample of cells. Samples can be collected with a urine test. This can help identify bacteria in your urethra, and a swab of the affected area. A swab of your throat, urethra, vagina, or rectum can collect bacteria that can be identified in the lab. Testing for other sexually transmitted infections. Your healthcare professional may recommend tests for other sexually transmitted infections. Gonorrhea increases your risk of these infections, particularly chlamydia, which often accompanies gonorrhea. Testing for HIV is also recommended for anyone diagnosed with a sexually transmitted infection. Depending on your risk factors, tests for other sexually transmitted infection could be beneficial as well. The treatment. Gonorrhea treatment in adults. Adults with gonorrhea are treated with antibiotics. This antibiotic is given as a shot, also called an injection. After getting the antibiotic, you can still spread the infection to others up to 7 days, so avoid other sexual activity for at least 7 days. 3 months after treatment, it is also recommended that you get tested for gonorrhea again. This is to make sure people haven't been reinfected with the bacteria, which can happen if sex partners aren't treated or new sex partners have the bacteria. Gonorrhea treatment for partners. Your sexual partner or partners from the last 60 days also need to be screened and treated, even if they have no symptoms. If you are treated for gonorrhea and your sexual partners aren't treated, you can become infected again through sexual contact. Make sure to wait until 7 days after a partner is treated before having any sexual contact. Gonorrhea treatment for babies. Babies who develop gonorrhea after being born to someone with the infection can be treated with antibiotics. Now, to the most important part of this video, the prevention. To lower your risk of getting gonorrhea, use a condom if you have sex. Not having sex and avoiding sexual activity is the surest way to prevent gonorrhea. If you choose to have sex, use a condom during any type of sexual contact, including anal, oral, or vaginal sex. Limit your number of sex partners. Being in a monogamous relationship in which neither partner has sex with anyone else can lower your risk. Be sure you and your partner are tested for sexually transmitted infections. Before you have sex, get tested and share the results with each other. Don't have sex with someone who appears to have a sexually transmitted infection. If someone has symptoms of a sexually transmitted infection, such as burning during urination or genital rash or sore, don't have sex with that person, and consider regular gonorrhea screening. Annual screening is recommended for sexually active women younger than 25 and for older women at increased risk of infection. This includes women who have new sex partners, more than one sex partner, sex partners with other partners, or sex partners who have sexually transmitted infections. Regular screening also is recommended for men who have sex with men. Their partners also should be tested. If you've been diagnosed with gonorrhea, do not have sex until after you and your sex partner have completed treatment and after symptoms are gone. This helps avoid getting gonorrhea again. Thank you very much for being with me to the end of this video. Drop your questions and your concerns in the comment section and I'll respond to it accordingly. Kindly subscribe to my channel if you haven't and share my videos to your family and friends if you find it informative. Till we meet again, take a very good care of yourself. Remember, you can also make a difference. And don't forget, Kofi loves you. Peace out.